My mission is to help pregnant moms understand how to find care in the vast field of birth services providers. My name is Doc Edwards, and this One Belly Wednesday, we're going to go through a little bit of a deep dive into some terms that you might find online when searching for a perinatal or pregnancy or prenatal chiropractor. So we had a really good conversation as we were trying to set up our website about what should we call ourselves. I have a tendency to use a word that's called perinatal. And so what that term means to me is that this is spanning the time frame everywhere from preconception to conception and fertility into that pregnancy journey, birth, and then the postpartum or postnatal phase of care. And that phase will usually, for most definitions, go somewhere between 6 months to 1 year after baby's born. So when I talk to my other fellow chiropractors about being a perinatal chiropractor, or when I talk to other birth services providers who are obstetricians or even midwives, I'll use the term perinatal with them. And we have used that extensively in our marketing. In fact, locally, if you look up perinatal, usually you're going to find my practice. But when you're talking to your average mom who might be going to see a chiropractor, we had a good question and a good piece of conversation within our professional group about, well, how do we make sure that you're finding us? And so there were 2 points that were brought up, and I want to share them. One is that pregnancy is by far and away one of the most searched terms on both Facebook and in Google when looking for birth services providers, because guess what? You're pregnant, and so that's what you end up Googling. And so for a lot of us, we have 2 minds about it. One is that, well, we don't want to get lost, right? We don't want to get buried in the vast array of all the different pregnancy things that you could be finding. But in second, we want to be found too. And so what are the kinds of things that our patients, millennial women who are expecting, a lot of them, when we look at demographics, a lot of them have a college degree, a lot of them are married, a lot of them have maybe more than 1 child by the time they find us, honestly. And so how is the best way to communicate our definition of what we do expressed to you, so it both hits you from a search engine perspective, then also something that just resonates with you heart to heart, like, yep, that's the right place for me. And so one of the other things that got brought up was the familiarity that most women have with taking a prenatal vitamin. They think, oh, okay, well, I'm doing this thing for my health. This is before the birth. Natal means birth. And so they're very used to thinking in terms of, oh, I take prenatal supplements, I should also get prenatal care. And that isn't just going to your birth services provider like your midwife or your OB and getting the checks and all that done, but also the things that we can do proactively. See, most of our moms have a tendency to be very proactive in a lot of other aspects of their health. So they make sure that they get plenty of exercise. They already know that they should be drinking water. They already know they should be eating good food and avoiding stuff that probably isn't really great for building blocks for their baby. And so all of those things are things that we make sure that as we are having a conversation about prenatal care, a lot of those moms are already proactive in being able to do those things. The other thing that we like to do is we like to have a conversation about what that time frame is after the birth. And so when we use the term postpartum care, that's a word I've been using for a really, really long time, mainly because when we start talking about things like postpartum depression, that falls into a group of a bunch of mood disorders that we call perinatal mood disorders. Again, very like, if I want to use the word medical or scientific way of discussing this phase that begins during pregnancy and then goes through, again, 6 months to a year postpartum. So when we start using words like postpartum care, one of the things that got brought up was that some moms associate the term postpartum care with exactly the thing I just pointed out, which is postpartum depression. And so do we, as if I use the word like vitalistic, like what we're interested in understanding how your body fits in with the natural world, understanding these salutogenic principles, what are ways that we can do to help build up your health naturally, build your resilience to things like disease, build your resilience to stress, build your resilience to gravity even, right? Or to toddlers keeping you up at night, right? What are the ways that we can help build your resilience from that salute to your health, generating that? How are ways that we can frame that in our language? And so one of the things that got brought up was maybe we steer ourselves away from the term postpartum care and into postnatal care, which is an interesting point because postnatal isn't really associated with things like mental health And so maybe more moms would be looking for those kinds of terms if they were looking to, say, get help with breastfeeding or get help making sure their pelvic floor switches back online. Because let's be honest, depends aren't sexy at any age. We want to make sure that our moms, after they birth, are able to activate their pelvic floor. 90% of the pelvic floor comes from automatic supply. And so that's why, as chiropractors, it's one of the things that we focus on during that phase of care is good, clean communication between the brain and the pelvis. So the last piece in here was about the word maternal, which initially on its face, I also really loved, because when I talk about pediatric care, that spans this range from the day a baby's born all the way, honestly, up till they're 18. And there wasn't really a really clean way to be able to talk about this other phase of care. And I thought maybe maternity care would be one way that we could do that. However, it was pointed out to us that, you know, we have a culture that is also very conscious about inclusive language. And so maybe some of our parents who, you know, may not identify with the term maternal may not necessarily want to search for that as well. So from our perspective, the way that we look at things right now, I think we're going through a really good exploration of having conversations about what motherhood, if I was going to use that term, what that looks like. What does pregnancy look like? And so I am really asking for your feedback on this too. When you search for things and you're trying to find care for your pregnancy and you're trying to find care after your pregnancy, what kind of terms do you like to use? I want to ask you guys out there in our audience to give us feedback so we know how best to communicate with other patients just like you. So leave us a comment down here in our messages. Always you can get in touch with us at Mama's Chiropractic. We're here in Cape Coral and Northport, and we're hoping to open up in Fort Myers very soon. So we've got some contracts and SBA loans out there right now to be able to do that. Super, super excited. We've got a growing practice, lots of really exciting things happening for us right now. It turns out that our guess about the COVID baby thing was real. We have been super busy, still seeing all those COVID breaches, which is another video if you want to look that up too. So until then, take good care. This is Doc Edwards, and I look forward to